Hello, welcome to Health Alert. I'm Pam Butler. Today we're going to talk about the flu, and joining me is Kathy Siebert. She's the Tulsa Area Immunization Coalition Coordinator with Tulsa Health Department. Welcome to the program, Kathy.
Thank you very much.
Now, you've been here before, so for people who have seen you before, this is going to be exciting again with a lot of new information concerning the flu.
Right.
Tell us a little bit about the flu in terms of nationwide, and before you start with this year, tell me how it looked from last year. How did we fare?
Well, last year was a rather mild season, and they think that this season will probably be a mild season also. They judge that from what went on during the fall and winter down in the southern hemisphere, and they study that so we know for our fall and winter season how things are going. Okay. And that's how they choose the vaccine combination viruses from what is going through the population down there.
Okay, and when you say mild season, is the flu kind of sort of associated with whether it's really kind of cold, a little bit warmer? Because you're right, overall last year we had a very warm kind of winter season. So is that connected to the temperature when you say a mild season?
No, a mild season would be like judging how many cases they had.
Okay.
And how many complications they might have had from it. So it's a little bit different than a temperature thing. It's more of how many cases did we have? Okay. How many complications and how many people died from it. Okay. And so we were very lucky last year, a fairly mild season, and we hope that if we're going to have a flu season, that it's going to be mild this year too.
Okay, now you did say something too in terms of the vaccine is based upon the previous year in terms of what is seen. Explain that to people.
Well, how they decide on what viruses that they use to make up the vaccine for this season, for example, is they watch what goes on in the southern hemisphere during their winter, and they see what strains of viruses cause the flu down in Australia and South America and what have you. And then they get together with the World Health Organization, and their analysts get together and they decide what types they want to put into the northern hemisphere flu virus vaccines, and then they start production in the spring after they make that decision. And then during the summer, the pharmaceutical companies are making the strains that will be for the fall season. Okay,
so sometimes when people say, and we'll talk about this in another perspective a little bit later, but sometimes people will say, well, I took the flu vaccination and I still got the flu, and they said it was some other type. So again, the vaccination doesn't cover every possibility and strain.
They're looking for the most often that has come up in that season before, and it is kind of a judgment call, and in most cases according to what that virus was. And so some seasons they're right on the nose. Other seasons we may have a bad season, bad quote unquote, and it might be just because something mutated or they didn't make a good enough choice. But there is a very involved decision-making process in that before they get to the stage of deciding on it. Okay, they do the best they can.
Exactly, and they pretty much hit it on for the most part, because we don't have a lot of people getting sick from other strains that really doesn't cover.
Right, and there's so many strains of viruses going around, and like you said, you can come down with a virus and say, oh, I got the flu virus, I had the flu shot. Well, it's one of the other viruses, because you cannot get these strains of flu from the flu shot for that season.
Okay, now let me ask this question, because we will in our second segment get into signs and symptoms and how we know and those things. But the role of the health department, no matter where you might find a health department, how do they approach the flu? I mean, what kinds of things do they do? And you can even use the local Tulsa Health Department as an example in terms of offering flu vaccination, surveillance. Tell me exactly what you do.
Well, they do a very extensive surveillance system. Most people don't realize that the emergency rooms are surveilling it. They're watching it and they're reporting it, and so they watch that They daily are counting what types of problems that they're having in emergency rooms, and then they collectively look at those, and the health department is part of the deciding what kind of problems are coming up in the community. They have epidemiologists at the health department, and they consider that, and then they start deciding what type of approach they'll have when their vaccines are going to come in. So most of them, will probably come in between now and October 1st. And then they start educating on that and making their plans for reaching out into the community to let people know where they can go and get their flu shots or flu mist.
And there are a lot of places where people can go, such as drug stores. There's a lot of places that will offer those. In terms of the health department, because people sort of think, in general, are they always free in terms of flu vaccinations, or is there a sliding scale, or does it just depend on the season?
Well, we're hearing more and more about medical homes, and now that there are people that have insurance, the health departments are usually saying, please, if you have insurance, go to your medical home, go to your physician or the clinic that you belong to, and get your flu shot there, because they can handle the charging of that and reimbursement. But if you, each one of the health departments in different states will have different qualifications for it. And if it's locally here, they will go ahead and have like a flu hotline. Here it's 918-595-4500, so it's very easy, and you can push a touch tone button for number 4, and it'll describe the flu, and it'll tell you where you can go to the health departments, their locations and their time, their hours, and the cost, and which particular if you're on Medicare, non-HMO, for example, or Medicaid, or Sooner Care for here in Oklahoma. There's just a handful of things that usually these little phone hotlines, and lots of states will do that, will give you the information for your local health department.
Okay, and then also with this, is it where the internet, in terms of resources, is that a very good resource for people to find information, or maybe even find out locally what's happening in their area?
If you're looking for a flu shot and you go out online and you put in there that you're looking for a flu location, flu shot location, it'll bring up your area usually, and you put your zip code, for example, in there, and it will recommend within a 5-mile radius or a 20-mile radius which pharmacies or drugstores, which health departments, even if there's some special events in your community that are a one-time thing, or if here in Oklahoma we have a caring van set up, if you can go to the caring vans and get just a walk up and do that.
So it'll list all of those special occasions and events and locations.
Right, in the area that you're in.
Okay. Well, we're going to take a really quick break and come back, and I want to start talking about the symptoms of flu, because how do we know? Okay? Please stay with us. We'll be right back.
Did you know that getting up and getting active for just 60 minutes a day is all it takes to help you get stronger, look better, and feel great?
Or that fresh fruits and veggies aren't just healthier and crunchier, they can taste better too?
Eating better and getting more active is easier than you think.
Yeah! Keep watching for some fun and easy ways to discover the magic of healthy living in your life.
America.
Let's get healthy together!
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back. To continue our discussion talking about the flu, joining me once again is Kathy Siebert. She's with the Tulsa Area Immunization Coalition Coordinator and the Tulsa Health Department. Let's jump in. Now, I do want to ask before we get to signs and symptoms of flu, who should get the flu? I mean, how young can you get a flu shot, and how, I never say old, how mature, how matured can you be in terms of really saying you need to look at the flu shot? Tell me about the age categories.
Okay, the recommendation from the Centers for Disease Control through the ACIP is 6 months of age and up.
Okay.
So that means everybody from 6 months and up can go ahead and get either a flu shot or the flu mist. The flu mist is for people that are 2 years of age to 49 years. But that's something that they don't get the shot. They just have to sniff the vaccine up both nostrils.
Okay, now some people may wonder, whoa, flu mist, the mist, okay, effectiveness. Is it known to be just as effective as the shot or an injection? Are there some issues there that we should know about?
No, it's an effective way of having your flu vaccination. You may have some symptoms afterwards, like a runny nose. I mean, that's the introduction area into the body that it's going. So sometimes people complain of some kind of little bit of a runny nose or cough, because that drains down the back of your throat a little bit. But certainly if somebody is between the ages of 2 and 49 and doesn't want to have that little needle stick that protects them, that gives them one option.
Okay, now in terms of sort of health conditions, sometimes people may say, well, what if I have a cold, or what if I have a fever, or I'm an asthmatic, or I have diabetes, I have some of these other things going on. Should I take the flu shot or should I not?
Well, if somebody's ill, usually a physician will go ahead and can decide, or a nurse practitioner can decide if you're sick enough that you shouldn't and have to wait. Most of the time, if a child, for example, or an adult has a cold, a mild cold, and no really severe symptoms from that, usually they'll go ahead and plan on getting the vaccine. But you don't want to immunize somebody who's already struggling with something more severe. And you do have people with chronic health conditions, and like diabetes or asthma, or they're immune compromised, and they need the protection not only by getting the flu shot for themselves, but they need all of us to get it to prevent them from catching it from us.
Okay.
So we're actually, in the community, we're part of the immunity that helps them.
I like that, community immunity. I like
right.
community immunity. Now let me ask this other question. What about people who say, well, I have certain allergies. I'm allergic to eggs, or I'm lactose intolerant, or how does that affect the flu?
Well, any of the ingredients or preservatives that go into any vaccine, if you're allergic to those, then that's something to talk to the doctor about and have them decide with you about it. There is some movement this year about egg allergies, and if the egg allergy is not severe, if you can eat foods that have cooked egg in it, or you can eat a little bit of egg and it doesn't cause you any kind of anything more than maybe just hives or what have you, they can go ahead and decide that with you. And they've been encouraging people in those cases where it's a very mild one to go ahead and get their flu shot. But it's always something you want to defer back to the doctor or the nurse or the nurse practitioner that's deciding whether you should get it.
Okay, another one for you. Persons who may be pregnant or think they're pregnant, they may say, well, I don't know if I should get a flu vaccination. What about that?
Well, they also need their flu shot or their flu mist. And the thing about it is that you're trying to protect somebody while they're growing a life, and the people around them. And also, you don't want to pick up the flu towards the end of a pregnancy when that brand new baby comes, and have the possibility that since it's 6 months of age and up that we can immunize infants, we can't do it 6 months below. So also, if mom is protected, that means that she won't be passing those particular strains of viruses in the flu on to that newborn infant.
Okay. What about mercury? Some people that may say, I have allergies to mercury. How?
Well, mercury, they have taken any kind of mercury out of most all the vaccines, and the only one that has thimerosal, and that's the name of it, that's in a vaccine, is in a flu vaccine in a multi-dose vial. So that means that it keeps any kind of growth down in this vial that's stuck into by a syringe multiple times. And so if they have concerns about that, they should talk to the doctor or the nurse that's giving them that, and they can allay any concern they have. If they're between 2 and 49, they could maybe opt rather to go for the flu mist, for example.
Okay.
Or for a single dose syringe of the flu vaccine.
Okay, to prevent that
and then,
mercury.
And since it's a single dose, there is no
There's
mercury,
nothing there.
no preservative like thimerosal in there.
Okay, well, let me ask this other question, switching into our symptoms then. Flu, cold, I mean, they all kind of look alike. I mean,
Right.
So kind of tell us the distinctions between the flu, at the same time, correlate that to a cold.
Well, the flu is like the worst cold you've had, and then some.
Okay.
So you're going to have a fever, you're going to have a runny nose, you're going to have a headache, you're going to have body aches, sore throat. You don't even feel like getting out of bed. It's hard for you to even function, and so if you're running a little fever and you got a little cough or something, that's not enough symptoms to let us know that you have the flu. So you probably got a cold, a regular generic old cold.
Okay.
But when you start getting into all those other symptoms and you can hardly pull your head off the pillow in the morning, and this will last a week or two. Usually the full course of the flu will take a week to 2 weeks before you get your strength back. I remember when my son had it and he didn't feel like getting out of bed. It was a full week of school that he missed.
Okay.
And luckily we kept him home and kept him from spreading it to anybody else by sending him off to school when he didn't feel well.
Okay, and let me ask this other question, because you talked about the sore throat, because oftentimes with a cold you will have a sore throat. Should the sore throat go away within 24 hours or 48 hours? Because of course you can, not only with the flu, but you can think about strep throat and other kinds of things. So how does that sort of sore throat act?
Well, the sore throat's going to bother you for a few days during that period of time. If it gets to where it's difficult to swallow, or if it's difficult for you to drink fluids, to hydrate yourself properly, I'd go ahead and call your doctor, because one of the side effects that can turn into complications is dehydration. So if you're having not wanting to swallow, if you're not even swallowing your own saliva, you could have strep throat. I mean, those can be very bad and make it hard for you to do that. But you'll find a combination of symptoms with the flu, like I said, with the body aches and the headache and fever and runny nose and cough. And there's
all of that will be a lot more severe.
It'll be a lot more severe.
Now let me ask this other question before we take a really quick break here. In terms of your period of contagion, how, sort of like the walking typhoid kind of thing, how contagious are you at what point? Are you able to spread this virus before you yourself start having symptoms of it?
Right, you can, and that's what's really deceptive. You think you're okay, but that for at least a day before to 5 to 7 days after you develop symptoms, you can be contagious. And it's the little moisture droplets from a sneeze or a cough or just talking to someone that can pass over to that other person directly and infect them with the flu virus. Or if someone sneezes or coughs on an inanimate object, you know, a tabletop or what have you, and you put your hands onto that, please don't touch your eyes or your nose or put your fingers in your mouth, because you're going to transfer it that way, because it can live a little while like that.
Okay, we'll take another really quick break and come back and finish looking at our symptoms and sort of some treatments and other things. Okay? Please stay with us. We'll be right back.
In 1977, in Johannesburg, South Africa, an 8-year-old boy picked up the game of golf from his father. By the age of 9, he was already outplaying him. The odds of this gentle lad winning the Junior World Golf Championships at the age of 14, 1 in 16 million. The odds of that same boy then making it to the US and European Pro Golf Tours, 1 in 7 million. the odds of the Big Easy winning the Open Championship once and the US Open Championship twice? 1 in 780 million. The odds of this professional golfer having a child diagnosed with autism? 1 in 110. Ernie Els encourages you to learn the signs of autism at autismspeaks.org. Early diagnosis can make a lifetime of difference.
Every day, thousands of people suffer from sudden cardiac arrest. Would you know how to help? Or would they be all alone? Learn what to do at heartrescuenow.com.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Check your steps at foodsafety.gov.
Welcome back. To complete our discussion on the flu, joining me again is Kathy Siebert. She's with the Tulsa Area Immunization Coalition. She's a coordinator and with Tulsa Health Department. Let's jump in. And we were talking about those signs and symptoms of flu and how far you can be contagious carrying it before you yourself ever get the symptoms. Now, let's talk about, put this in the context too of the school-age child, because many schools are very concerned about that. How long should a child stay out of school? And then factor in with adults as well, going to the doctor, is there something they can take or give you that will kind of cut the duration of it?
They're called antivirals, and if you feel like you're coming down with the flu, within 24 hours, 24 to 48 hours, contact your physician, and there are medications that they can prescribe, and you take them, and it will give you a lighter case in many cases, and that's very helpful to you. Instead of staying down for a week or two, it may just be you feel miserable for a couple of days.
Okay, and in terms of how long you should stay out of school, especially if you were running a fever or things like that, tell us about that. Or from work.
Right, yeah, right, exactly. Don't take it to work either. It's one of those things where if your fever has been down for 24 hours without use of any kind of fever-reducing medication, then it's okay to return back to your normal schedule, whether it be school or work.
Okay, and then just normally and in those environments, tell me the importance of hand washing and, sort of hygiene in terms of coughing and sneezing and tissue and how to dispose of them and the arm, all of those things.
Well, if you have a cough of any kind, you want to go ahead and use a tissue to catch the spray from that, and then discard the tissue in a proper receptacle, a trash can. Also, they're teaching kids in school now to cough into their upper sleeve up here. When it gets onto fabric or gets outside the body and out of the way, it's less likely to spread, and the germ can't live in that fabric for any length of time. So that's why they're saying curb that cough up in your sleeve.
Okay.
And I've seen that very successfully done. So, some children will do that. I think, oh, good, they're really learning.
And adults,
right?
Because we need to have the same kind of hygiene methods as well.
Big sneeze coming, just move it right over into your sleeve.
Okay.
Disinfectants, the disinfectants that they use, and you can even use the household bleach in with water. Where it's diluted down, and then wipe the surfaces of desks, for example, or desks at work, or cabinets, countertops, the microwave oven, down by the water cooler, anywhere there's a place where people congregate or talk. That's where that mist is, the spray is going to be able to sit until you come along with your fingers and pick it up.
And people don't think about, because I did see that on the news once, in terms of our computers and keyboards, especially if it's not your own personal one that you're using exclusively. How many germs can really be on that keyboard that you don't even think about?
There's an enormous amount of them. It's one of the highest places that you would think you wouldn't think that they'd be there, but that's true. So you have to be really careful, and it would be wise to go ahead and clean that. You can check with your IT department, see what they want you to clean the surfaces of the equipment with.
And I think it's important. Some grocery stores will do that, especially during the cold and flu season. Have the little Sani-Wipe things that you can use to wipe the handles, and anything that you can do to help, and using your own ink pen. Just a plethora of things that you can do.
Right, and you can carry the hand sanitizer with you and use that often. They say please wash your hands as often as you think about it, and the little children are learning how to wash their hands by singing happy birthday twice. That gives you about 20 seconds worth of proper hand washing to get rid of those germs.
Right, and then you can go online or talk with your school nurse, or if you're in the work setting with your health area, or go online to see proper hand washing, because I know we don't have time to talk about all that, but there are ways that you can wash your hands properly and ways that you don't, where you just basically reinfect just what you just did. So that's really critical to know. Now tell me a little bit about, I want to get this in, about petting zoos and things in relation to children this year that we're a little more concerned about in relation to flu and viruses.
Well, over the last couple months, they've noticed in some of the Midwestern states that there is some type of transmission of a swine type illness from the swine or pigs to humans. And so some of these ill pigs are actually sending that virus over to the human population. And if whoever's caring for them aren't careful and wash their hands carefully, they're even advising them to use gloves when they're dealing with ill swine. And it puts us in this situation where now that it's fall and we have these wonderful petting zoos with the pumpkin patches and what have you, that they're advising parents and teachers that have kids that are going into these zoos to consider whether they really want them to get up close and personal with these animals, because it's possible that if they don't wash their hands afterwards, that they'll put their fingers up in their mouth or their eyes and they can spread it to themselves. When you take an infant in there, everything goes into a baby's mouth. If a pacifier falls on the ground or a bottle or even the stroller, they're recognizing this and they're asking you to consider for this season to stay out of that until we see an end to this particular H3N2 variant, is what they call it.
And that's not a part of the flu vaccination at this point, because people might think, well, that's probably something they put in there, but it is not.
It isn't. It won't cover that.
Okay, now if a person gets affected with this strand, is it a more severe kind of flu or not? We don't really know yet.
We don't really know, but they are watching it, and they'll continue to monitor that. But it is another nuisance kind of thing that to somebody with a healthy immune system, they'll be all right, they'll be able to get through it. But if you have somebody that's immune system isn't, it can become a very bad complication for them too, just like the flu.
Okay, well, in our last little minute here, I just want to highlight quickly a couple of other things that are in this season. The pneumonia vaccination, is that still recommended, and what's the age for that?
Well, pneumonia vaccinations are recommended for people, if you haven't had one before, to go ahead and get it as you're headed towards your senior years. Talk to the doctor about it if you have a chronic health condition, and see if the physician will recommend that you need to have one earlier than that. But certainly when you're getting up in age of 65 and up, that's a good time to talk to the doctor about it.
Okay, and really quickly, can you get the flu vaccination and the pneumonia vaccination same day?
Yeah. Okay. Yeah, they can do that for you.
Okay, thank you so much for joining me.
Thank you.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/HealthAlertUSA. And remember, look at these vaccinations so that we can all participate in our community immunity. Take care.